Hello, good evening, dear Cairo Climate Talkers. Welcome back, and thank you for joining us on this new digital platform for CCT number 67. As you all know, this corona crisis hit everyone around the world more or less as a surprise, and of course it has also affected our work at CCT. And during the last month, we have all faced the restrictions of having to work from home and to follow social distancing rules. And while things are appearing to get better in some places, other countries are facing even stronger outbreaks than in March. So it's therefore important for all of us to stay careful and to protect ourselves and our loved ones. And one of the consequences of this corona crisis is that we're not able to hold our usual CCT events with all of you in person for the foreseeable futures, even though we all miss social contact more than ever. And I think we all miss the format that we used to do until I think in February, where we could all meet in the DAD gardens afterwards. So unfortunately, there will not be an opportunity for us to mingle in person after this event like we used to do it. In the last month, we have all also learned to use new tools of communication. For example, using video conferencing apps instead of attending meetings in person. And here at CCT, we used the time we had to think how we can adapt to this new situation and how we can best work with you all and all of our partners and stakeholders to continue promoting awareness about climate change while remaining vigilant with regard to the virus. So I'm very, very grateful to our speakers, our stakeholders, and of course our entire CCT team for making today's first online CCT possible. And please bear with us should we have any technical glitches. So today we want to talk about planetary health, and I think this is the perfect topic for us to start our series of virtual CCTs. The crisis with Corona has made us all realize that our health is a key factor in how we can live our lives. And the more we learn about this virus and our health, the more we understand that our personal health is inseparably connected with our planet's health. From the destruction of animals' habitats to air pollution, there are numerous factors that are connected with the spread of diseases like Corona and how we are affected by them. And actually, many of them are still unknown to us. And while a reduction of air travel may have reduced some harmful emissions in the short term, the crisis has also led to an increased level of other forms of pollution, especially with the use, for example, of one-way masks that we have seen on the streets in many places. And I think what small gains there might have been for the environment in the short term while we humans have been isolating will probably be lost when we restart our economies fully, unless we all choose to act more responsibly and to focus on the health of our planet in these new times. And I think this crisis should serve as a reminder to all of us. Protecting our planet's health is not just a noble goal of some idealist activist. It is absolutely necessary for our own survival as human beings on this earth. So I'm very, very grateful to our distinguished speakers for joining us from Germany and Egypt today and for accepting to discuss this crucial topic with all of us. And before I give the floor to Lily to lead us through this event, I would like to thank all of our stakeholders and partners, and especially our close partners at the Ministries of Environment and the WEAA and the Ministry of Foreign Affairs for their continuous support of CCT, even and especially in these challenging times. Thank you to the whole CCT team for all your work to make this event possible. And of course, thank you to all of you for joining us for this CCT number 67. I wish you all a very interesting discussion. And even more importantly, I wish you all to stay safe and healthy. Thank you.
Thank you. I'm the first one to forget to unmute myself. Perfect. Thank you so much, Philippe, for these words of greetings. Thank you so much. I want to begin with asking a very small question that is a very big question, very important for what we're talking about today. So we have this great polling option here, which I'm going to launch now. And the question is, do you already know what planetary health is? Because planetary health is a very new approach and a very new transdisciplinary way of looking at the interconnectedness of the environment and human health. So we're very excited to have that opportunity to discuss this now and to watch live how many of our participants have already heard about it and have not. So this is interesting. For now, it's very equally between yes, no, and I have an idea, but not know it very well. So I think this is going to be very fruitful for the majority of us. So what is planetary health? I think planetary health is very fascinating, but at the same time also terribly needed approach. that we need in order to really understand what is the challenges in the future and be able to approach them together. Most importantly so, because we are now in the era of the Anthropocene, where the humans are actively changing the planet, actively impacting in very dramatic ways the Earth's natural systems. And in the past decades, we have seen that human life and human health has dramatically improved with much lower child mortality rates, increasing life expectancies. So we have seen this major progress that was also possible because of technologies. And now, partly due to these technologies, we're at the verge of actually risking these health benefits. I think many of us know this image of the world. It's a viral image of the world looking very sickly and wearing a scarf, having a thermometer in the mouth, and another planet comes by and asks, what's wrong with you? And the world says, oh, I have humans. So I think that is a very often used image to show that really we as humans, we are contributing to making the world sick. And in turn, that makes us sick, right? We are faced with climate change, declining biodiversity, a shortage of agricultural lands, shortage of water. There's new and mutated infectious diseases, decline of nutrition in the food that we're consuming, and we're exposed to air and water pollution and other chemicals such as pesticides. So it is very obvious that these things are affecting our health. And moments like these, moments like the COVID-19 crisis, the health crisis, is so much more than just a health crisis, because it is also a climate crisis. There's an interplay, as Philippe has already mentioned, for example, the effect of the solid waste, the increasing solid waste that we're seeing is going to have an effect. And at the same time, also these climate and health crises, they're not only deeply connected, but they also create new reverberations of the problems that we're seeing. So COVID-19, wildfire, floods, they affect and threaten also the well-being and socioeconomic safety of populations. And then this compromised socioeconomic safety further on leads to, for example, delayed childhood development because of the health implications, chronic disease patterns because of the lack of access to primary healthcare services. So we can really see that all of these things are so complexly intertwined in very interesting, but also sometimes really hard to grasp and very hard to tackle ways. And that's where planetary health really comes in, where planetary health says we can only tackle all of these issues if we are working transdisciplinarily, if we're really bringing together the creativity of everyone, the knowledge of everyone, the solutions of everyone, and basically begin to not only collaborate, but also co-create solutions. And therefore, it is really in a time like now, where we're all linked to the screens, where we all have different opportunities to engaging with each other, where we are learning new ways of engaging with each other, that we really use that in order to increasingly also co-create and collaborate across all disciplines, across all silos, in order to address the climate and health crisis together rather than as a single issue. One of the things that I think this has really shown us is that this health crisis has a domino effect. And so does our climate crisis. It has a domino effect. And I think once we start to understand that all of these different issues are really so codependent in so many different ways, we can really start working together in much more fruitful ways. So before I'm going to take more time, I'm very excited now that we are come here together. We have the ability to come here together in this virtual setting that is not contributing to any CO2 levels increasing, or at least not as much as it might usually do. None of us had to take a car to go somewhere. None of us had to take a plane to go somewhere. So like this is a great addition already, I guess. So now let's go to the most important part of this panel, which is obviously our panelists. And I'm so very excited to have all of you here join us today into this and join this amazing discussion. I want to begin with introducing Dr. Wagida Anwar. Thank you so much for joining us today. She's a professor of public health at the Faculty of Medicine at Ain Shams University. Dr. Anwar is a professor at the Department of Community, Environmental and Occupational Medicine at the Faculty of Medicine. And Dr. Anwar is also a graduate from the Faculty of Medicine at Ain Shams University, so she stayed true to her roots. But she did obtain her training from several institutions in different countries, such as France, USA, Germany, Sweden, Canada, and Finland. She was also the General Coordinator of Health System Improvement Programs at the Ministry of Health and a member of several national and international committees. She has a role in encouraging research at the Egyptian Academy of Scientific Research and Technology, and she's a member of the National Committee of Toxicology, the National Council for Environmental Research at ASRT, and the president of the Egyptian and Pan-African Environmental Mutagen Society. Thank you so much for joining us today. Secondly, I would like to introduce Dr. Nicole de Paula. She is a Klaus Töpfer Sustainability Fellow at the Institute for Advanced Sustainability Studies at the moment in Potsdam. So she's joining us from Potsdam without having to use a plane, which again makes me very happy. Dr. Paula holds a PhD in International Relations from Sciences Po in Paris and has been consulting with several international organizations under the UN systems on themes related to climate change, biodiversity, chemicals, financial and urban affairs. For more than a decade, she has been globally connecting policymakers and researchers to create a public understanding on key issues related to sustainability, the environment, and public health. Before beginning her work at IASS in Germany, she was the director of a think tank in Bangkok, Thailand, hosted by Mahidol University at the Faculty of Public Health. She's also the founder of the Women Leaders for Planetary Health and co-founder of an interdisciplinary research group on planetary health at the University of Sao Paulo, Brazil. Her mission is to promote research and inform the linkages of health and well-being with sustainable development, environmental conservation, and social equity. Her most recent research focuses on decision-making and international cooperation in the post-COVID-19 world, as well as digitalization and sustainability. Thank you so much for joining us. Thirdly, we have Mrs. Ragia Elgerzawy, who is an environmental and health file officer at the Egyptian Initiative for Personal Rights, the EIPR. She's also a medical doctor by training and graduated from the Faculty of Medicine of Cairo University and clinical pathology. In addition to her work as a medical doctor, Dr. Ragia has also been involved in civil society activities related to health rights and environmental justice issues. Acknowledging the solid interconnection between health, development, social justice, and environment, though, Dr. Ragia shifted her career to environmental justice. Her work mainly focuses on environment pollution, sustainable development, energy, and climate change issues. Thank you so much for joining us as well.
Thank you.
So to jump right into the panel discussion, as you can see, Dr. Nicole, from the title of our CCT, we found our inspiration in one of the articles that you wrote, where you wondered if we are actually asking the right questions. And I was wondering, maybe you can give the audience a short insight into what you asked yourself in that article when you said, are we really asking the right questions when it comes to health during COVID-19 times? And maybe also if you feel like there are some additions that you want to give towards what planetary health is and where it is at right now. Thank you.
Thank you. That's wonderful to be with you all. Thank you for the invitation. And it's really inspiring to have, you know, a short article that we put it out there and that can inspire an event in Cairo with zero emissions. That's really fantastic. So I'm truly honored. As I said, this article was an interesting perspective because at the beginning of this pandemic, we were all, I started seeing some climate activists or even the youth sometimes, but not only, people were starting to celebrate a little bit, you know, like, oh, that's great, we have COVID, and then how great it is for climate change. And then that was something that really bothered me because obviously climate change is about environmental justice, as you know, some of the panelists here are experts on. And we know that I start thinking, is it, although, you know, people maybe for the first time, they were able to see some clear skies and mountains in Beijing, you know, for so many months and I don't know if years maybe, but we thought that from the perspective of environmental justice, that was not really seeing, you know, millions of people were dying, and that's not how we want to solve climate change. So that was not a real solution. So that's why we wanted to start the conversation. And I think you did a brilliant job at explaining what is planetary health. So that really makes my life here very easy. The only addition is that the second motivation was that instead of seeing, because some people are starting to not complain, but being worried, oh, how are we going to do? You know, just now that we're getting so much attention on climate change, you know, we have this health problem now. And so the second motivation was, which is linked to this, it's also, you know, these agendas are not necessarily separate. So you also gain a lot if you start thinking in this holistic way of crises that are, you know, together and should be solved together. So I also congratulate you for putting this event together and, you know, bringing this space to have this conversation in a little bit more complex way, which is we don't like complex conversations because they are more difficult. And, you know, I also would like the things, you know, my life would be simpler, but, you know, that's the situation we are. And so it's good to first acknowledge this. So the planetary health, I would like to call it also as a narrative, right? Because it's so broad. It's not that we have a technical solution called planetary health, but it's a way of seeing things. And it really was gained force when it was launched in 2015. There was a report called Safeguarding Human Health in the Anthropocene Epoch, and was a report from the Rockefeller Foundation with the Lancet Commission on planetary health. So that really gave a lot of space and power for this community to grow. And after that, the Planetary Health Alliance was created. It's hosted by Harvard University. And now we are, you know, started very small, and the first meeting was 2017. And I've been attending all these meetings. So I'm, you know, an enthusiastic person in the planetary health community for almost now 5 years. So I'm glad that seeing that this, you know, through this strategy of the pandemic, at least we can start posing the right questions that perhaps this links, you know, we should pay more attention to it. Thank you.
Absolutely fantastic. Thank you so much. And this actually begs also the next question for me, which is, now that we did the Q&A and we see that a lot of people kind of know what it is, but most but are not so sure. Maybe Mrs. Ragia and Dr. Wagida, maybe one of you or both of you want to also add to that and say, what is the current discussion on planetary health and in Egypt? Is that a concept that is known yet? Is that a concept that is not really discussed yet? Maybe you have some insights on that.
Okay, I can say. Yeah. First, I would like to thank you for the invitation, and I'm very, very impressed with the, you know, choosing this topic. It's very, very important, and I hope to continue the discussion because 1.5 hours will not be enough to talk about everything. You know, terminology changes, but people are working in the same concept, but in a different way. As it was mentioned, it's a holistic way of thinking and involve many disciplines. So maybe people working in different institutions and different disciplines, but they don't talk to each other. So what is missing is the connections or the coordination or the, you know, talking. It's limited, And especially with the corona and no meetings and only papers, exchanges of papers and documents and you know, Zoom meetings and so on, which doesn't transmit the concept well. So it needs more explanation, more you know, practical way of implementation to link all the actions taken before in a productive way towards the solution of this big problem. Okay.
Thank you so much. Ms. Ragia, do you want to add something to that as well?
Well, it's difficult to add after my colleagues elaborated and said everything. Just I want to, yes, stress on a few points that, well, the connection between the health of the planet or the environment and the human health has been pointed in different ways. So I remember the WHO, it was the theme of one of the years, and you celebrated that in the CCT. The WHO declared that climate change is a major health threat, and as you said, threatening all the gains about improving child mortality, about conquering infectious disease, and so on. And then again, it was raised in a concept of One Health, claiming that and trying to draw the attention that the health of the human, the health of the animals, and the health of the plants are all connected, which is really are. And then the planetary health, I think, is making use of the previous and building on, trying to raise it to a better stage. So it's interconnected. I think the COVID-19 gave it a strong momentum, that it is literally, we are sick because we destroyed the health of the planet. So it is now very crudely explained. So maybe it will get the needed attention this time. Thank you.
Thank you so much. Yeah, this also makes my work as a moderator so much easier, because you already brought it back to COVID, which we're trying to do, of course, as much as we can during this discussion. Thank you so much, everyone, for your insights on planetary health also, and the different steps that it takes as we go. I'm curious also to know, to get a little bit of a background on what's happening in Egypt. Maybe Dr. Wagida, you could elaborate a little bit on what is the situation right now, what kind of effects does climate change and the way that we affect the climate already have on human health in Egypt in particular?
Yes. Yeah, there are many discussions around the effect of climate change on human health. And, you know, you summarized at the beginning of your talk about what can happen, you know, on the health in different aspects. Also, in Egypt, the main concern is the pollution, especially the air pollution due to the vehicle emissions and so on. How it is, you know, related to the climate change or the pollutants which happen in the air. Another problem is the solid waste. It's a major problem, and then now the government has a big project for both directions, you know, to counter the solid waste and this vehicle emission. You know, it needs many actions, multidisciplinary, and the Ministry of Environment is coordinating between different disciplines. You know, it has also, yeah, it needs also this risk assessment studies to prove that what happened in health due to these pollutions and these pollutants around. Or the climate change how it affects. It's not only in Egypt, but all over the world. You know, this kind of studies is a long term and needs cooperation between different research institutions. So it's not just opinion or observation, but it needs a large scale studies.
Thank you so much. Yes, very true. This is everywhere in the world, of course. It's always, of course, closer to where we are in this moment. And as I'm also based in Cairo, it's always also interesting to see like how is this specifically here in this context. Now, I'm also very interested to hear from Dr. Ragia, your work on environmental justice, and it was mentioned before, but maybe you can also give us a short explanation of what environmental justice means so that our audience can understand how that is important if we're talking about planetary health.
Okay, thank you. Environmental justice is a concept which entails that not everybody have the equal or just access to the services of the environment or protection from the risks and pollution of the environment. So, for example, it's known that poor people are more prone to the complications of the climate change. They live in more prone areas and they cannot protect themselves well. And they don't have also the same accessibility, for example, in the fishing or in even the cultivation, either because they are poor or because they are of some ethnic groups or because they are gender, for example, women are more subject to the drawbacks and the pollution. So it is the importance of this concept in working is that it also aims to protect the people, and this will protect the environment, because without protecting the people, it's very difficult to protect the environment also. Poor people cannot be good to the environment. I cannot ask, for example, a poor farmer not to put a lot of fertilizers because he cannot afford to have a weak production, to put a lot of pesticides, although this will hurt the land on the long term, but not wait for the long term. It's the same in different aspects. If you want to protect the environment, we have to protect the people and give them equal opportunities for the benefits and also to be protected from the pollution. We know that the dumps, for example, or the waste collections are near the houses which the poor lives in. Uneducated people, they are more prone to the disease because they can also work in hazardous occupations. So this is generally the idea of environmental justice.
Thank you so much. And also maybe a follow-up to that. What do you, if you could, or if you can choose maybe like what is, or identify what is one of the most pressing issues right now that you're dealing with when you're talking about environmental justice?
Well, I think in Egypt, generally, we have three big issues. We have the climate change, which Egypt is very prone to the climate change dangers because of the delta, because of the expected sea rise and the salination of the soil, the extreme weathers. And then there is the pollution, which, like Dr. Wagida kindly said, the air pollution. Egypt occupies a very high rank on the air pollution. In the year 2016, the number of deaths attributed to air pollution in Egypt was about 60,000. We have also pollution, water pollution. It's not only air pollution. We have the Nile is not very healthy because of also the low percentage of sanitary disposal of waste. We have a lot of waste dispersed. And then the biodiversity, which there is a lot of, there is the risk of the desertification. We have that. We have the salination of the soil, which is also a big risk. So we are prone to really huge risks on the health, on the livelihood, on the lives in Egypt. It's not, the risks are not distributed equally. As we can understand, it's very obvious who will suffer more, who the jobs, as we have seen in the COVID-19, people who couldn't stay or isolate themselves in, and they had to go to the jobs because otherwise they will die also of hunger. So they have to they were exposed, they work in non very healthy spaces. Maybe they are suffering from malnutrition also, they don't have adequate food. So it is complicated or interconnected.
Yeah, thank you so much. And yes, I'm just also thinking that there's all of these articles that we've seen globally coming up, right? Where they were very much where the marginalizations and the inequalities that we have in societies become so much more clear now through the health crisis, right? Specific groups of people who are so much more affected, who are so much less likely to have access to treatment or even testing when it comes to that. So thank you so much for pointing that out. It also leads me to ask a question to Dr. Wagida again, where like you as a medical researcher, but also as someone who is part of policy implementation programs, I'm also wondering, like, do you see that there is a shift in the conversation that this health crisis and these appearing patterns of marginalizations that we see because of COVID-19, are they affecting, or do you predict that they will affect the way that policies are made or that studies are going to be conducted?
Of course, dealing with health, when the COVID-19 started, it affects the health of the people from other diseases. Like the non-communicable diseases, no care, all the attention was given to the COVID-19. And I would like to emphasize that this kind of, what I'm saying, needs confirmation and studies and data to confirm. But I want to say, the debate about relation between environment and COVID. There was a discussion about, the particulate, the suspended particulate may, the virus can be deposited on them, and this can help in transmission of the virus. But this is a way of the environment can affect the transmission of the virus. During the COVID, there is accumulation of waste, a new kind of waste. It's a plastic waste, like the gloves, the masks, and also exposure to certain chemicals for these infections. And people misused this kind of sprays and the spilling of chemicals. So I'm sure this will affect the environment, either air or solid. So it needs revision, all this kind. The health system, thanks to God, it coped with the cases happened with Corona, and now the cases in Egypt decreasing. So the use of intensive care and ventilators and all this are the need is decreasing. So I'm glad that this happens because there was a cooperation between the Ministry of Health and the Ministry of Higher Education and the hospital, the university hospitals, and even the private sector played a role in accepting patients and having specific hospitals for the isolation. So all this, it's a kind of management and arrangement from different ministries that help to make the health system resilience to the COVID. I don't know if I'm answering the question or not. Yeah.
No, this is actually perfect. Yes, because you're actually like I think it kind of shows how there is just there is a combination of different
yes, the source of infection and you know how we manage the cases, and we are trying not to pollute the environment by the daily activity of the patients and the public.
Exactly, but then on top of that also, which I think is interesting, is that because of this challenge being like affecting so many different sectors, right? Then because of that also, like so many different ministries now had to kind of work together,
cooperate,
right?
yes.
And had to cooperate, which they usually don't tend to like to do too much, I feel. But now they were kind of forced because they were all...
Actually, it's like a fighting an enemy. Yani everybody, you know, wants to. This corona or the COVID was very strange to everybody. You know, yani unexpectedly affect many people around us.
And in many different ways that we didn't really probably imagine before that it would have that effect. But this question of like what is this going to mean also like for policy making, but also, you know, in academia, I'm wondering, Dr. Nicole, maybe because you said that in one article you said that planetary health is both a growing scientific field and a social movement. Now I'm very interested to see like what would that look like in real terms, like in reality translated, if you have insights on that.
Yeah, thank you. It's fantastic conversation so far, and we see these complexities, right? And I think part of the answer to this question, it was tackled by when we were talking about this injustice. So the idea that planetary health is a scientific field and also a social movement, we wrote that, but also comes from the community, right? That's not an idea that I just had, but there was, you know, coming from the manifesto and leading people also who started these discussions. And I think the main point is that usually what we discuss, the social movement part is because as we are seeing, you know, the terminology is evolving, doesn't mean that this for the first time we're thinking about the connections between environment and health. As it was, I think Dr. Wagida mentioned, you know, there was One Health and there were other concepts, eco-health, we can talk about, you know, tropical medicine, conservation medicine, the things that they have been there for 40 years. But perhaps the difference now is that it's this conceptualization of, you know, that you need is planetary health for action, because you do need to translate the scientific knowledge to the general public and to decision makers. So that's a main point. And with COVID, people were so sensitive about, you know, everybody was at home thinking about their own existence, about their own lives, and what does it mean to be alive in the 21st century in a pandemic. So as we saw, and we are still seeing, this all the other, you know, important movements and connections are emerging and questioning even the climate change movement through, of course, with the movement of Black Lives Matter, that's, you know, gained a lot of force now. Not only, of course, they've been there also for a long time, and it's a problem that is older than climate change, perhaps, you know, and then we are seeing that these things go together, and that's the part that we are touching on: social movement, on environmental or whatever, social justice. So planetary health, I think, is also a way to call attention to this inequalities, and that we need to, you know, have different voices. I think it's about having unheard voices, make this more powerful. And, you know, because part of the solutions that we have seen, for example, over attention, an excessive attention to technologies, for example, that's one narrative. And you see that's even now, not everybody has access to Zoom. And as we're seeing, even this small little technical difficulty that we have, we don't have the button in Arabic for the moment. That's a way to show that maybe people are not using, and they were not a priority at that point, you know. So how do we make the solutions for planetary health if only, you know, 10% of the population is there taking decisions? So that's why I really enjoy is that we need to get more science. Of course, there are many knowledge. I mean, by definition, knowledge is really infinite, right? As more as you learn, then you see, oh, there was this, and you keep going. But we already have knowledge enough to know that we are in a crisis and that we need to tackle right now. And then we need to have more, you know, different voices around the table, and especially on decision making. And I think someone here mentioned the role of women, for example. That's a very interesting aspect that I'm also very curious to hear your opinion for people that are based, you know, in Egypt, and how is this perceptions of decision making and to be more diverse.
Yeah, thank you so much. And this is also the perfect way to bring Dr. Ragia back into the conversation as well, because I'm also really wondering, like, maybe you also have experiences from, like from your research in Egypt or also outside of Egypt. Like, what are good ways that you already saw, like, to build bridges between the divides, or to bridge the divide between health and environment? And the policies that are being made in that regard?
Well, this is a very good question and a very good challenge. I just want to, I now, as we speak, I felt that there is maybe some point, I'm not sure it was clear or not. We have some of the audience said that they haven't heard about the planetary health connection to human health, but I mean, now it's more and more known that destroying the wildlife, destroying the biodiversity, encroaching on all these forests and clearing them, and then cultivating and interaction. So destroying the wild habitat, the interaction near it is the cause of all these new emerging diseases jumping to us from animals. And the 21st century in particular, since it started in 2003 with SARS, followed by avian flu, followed by swine flu, followed by MERS, Ebola again, Zika, and then the corona. So it is non-stopping. That's why it's a very good time to say that human health is part of the planet health to really and quickly die. We know from a long time that the climate change is killing us, it's killing people all over, even in the extreme weather, we are going to drown, there is no food, but it's not dramatic as what's happening here. So this is a very good chance to make it obvious. Maybe it is obvious, but there is some kind of inertia, really. We know, people know, and it's a lot of articles, a lot of research about the effect of destroying the environment, the climate, the pollution on the health, and calibrated, and the number of deaths related, and then the actions taken even for the climate change, the action taken to curb the rising temperature is limited, and you wonder why. So this is really a tough question, but in a trial to make some suggestions, which I hope it will work, I think. Concentrating on the health sector itself is the lead. I mean, we have seen that all over the world, and of course it's more in developing countries like Egypt, but all over the world, the health systems were overwhelmed, strained, and many of them failed. So the health care needs to be really, really strengthened. The expenditure on healthcare is very little. Even in countries like the United Kingdom, we have seen that NHS is suffering, and in the developed, so we'll not mention countries like Egypt, but it's very little. It's even below the constitutional marks. The expenditure in Egypt is less than 2% on from the GDP. So strengthening the health system is very important. Mainstreaming the environmental and climate change issues. I can't think a doctor knows what are for example, not all the doctors, of course, doctor like Wagida, she knows very well, but these are the experts. But I have learned, I've received my education, of course, and I think also even the newer generations, we don't know how the infectious disease the new infections are going to be seen. We haven't heard about leishmania, for example, only theoretically. Now we have cases. We have outbreaks of the dengue fever twice in the last 10 years. and these were rare. It's going to be, there is, doctors should be educated about what to expect. There should be surveys done. There should be hotspot. There should be emergency plan included. The health system should, because expanding the insurance, improving the primary health care, without protecting the people. The COVID is not the last crisis, because with this situation we are expecting more to come. So this crisis, it showed us the shortcomings. We should take care of them. We should take, in Egypt, we lost a lot of doctors, and we have shortage, not only doctors, all the medical team, of course. We lost more than 100 in that short time. So, and we have shortages in many things. So taking care, improving the health system, educating the personnel working there to put the climate change. Even when we advise, the doctor, when we advise, for example, a patient about doing some exercise, how about this, pointing that it's good to make mobility, to use the bicycle, for example. So I think we can start with the health system. Of course, we need transsectoral intervention, but this is very difficult. And here in Egypt, it's not easy crossing the boundaries. And I'm not the expert. Maybe Dr. Wagida knows better, and what are the kinds of trials it's been doing. I know the Ministry of Environment is trying, but the Ministry of Health is now a good candidate. And I think they will be more willing to incorporate this and be prepared. We can have, for example, like we have seen in China, for example, we can have an extreme event during when we are fighting the crisis of the COVID. It will be disastrous. We had floods, and maybe you have another any acute event. So preparation is good. We can also, and I think this is well, this is just my thinking, so I hope it will be valid. I haven't read it, but the crisis showed a lot of active youth and young men and people doing a very good work in the social network, either supporting food for the needy, or even transporting oxygen for those in need, helping them get to the hospital. Maybe we can build on this available network. The civil society, some organizations can work with them, or even the Ministry of Environment. We can build on the behavioral changes made, like you said, working from homes, remote working, changing the times so there will not be a rush hour. People need to think of it. I just some ideas. Thank you.
Thank you so much. Yes, I was actually also like very positively surprised to see that, for example, in Berlin, the Fridays for Future movement very quickly shifted their ability to mobilize young people into helping them support people who, for example, couldn't go shopping for themselves or so on. So really, yeah, like use that activism and kind of be able to switch that to different crises and basically use the network and the approaches that we have. I want to go back to something that you were saying though about the health system and how important it is, especially important now, to invest in that. And I think maybe Dr. Wagida could be our expert in this one as well.
Yeah.
You have actually worked on the improvement.
Yes. But before talking about the health system, I want to talk again about how climate change lead to the epidemic. This is very important. I read about it, and yeah, maybe it was mentioned, in this session, but I want to emphasize that due to climate change, the deforestation happened, and the animals go out of the forest, and and go as you know, the COVID started in an animal market. So in the animal market, several animals together, they are still living and maybe transmit infection between each other. And then comes from animal to human transmission. This zoonosis kind of diseases is, yes, it's common, but it needs many people to know about it, because not every animal cause a disease, but needs more attention for the health system, because it's a source of infection coming, like, the climate change increase the viruses, increase the bacteria, and also the animals coming out to search for food or so. So it may affect. So this story needs to be clear to the people. Yeah, it's not a surprise. Then coming back to the interdisciplinary, this interdisciplinary between different ministries and different experts and civil society, they need to first to plan together. In the planning process, they need to be together, and in the implementation process, need to be together. And in every step, there should be a connection. Through this, my experience, I was sharing in putting the strategy, the sustainable development strategy, talking about the sustainable development goals and how to be integrated. This is a very complicated process, but needs to be done, because most of our problems interlinked to each other. Among them, the climate change and the effect on health and so on. Also the universal health coverage, which is a terminology also all over the world, which means that every person receive a good care, and should be covered good quality services, and should be covered financially, not to cause any burden on the family and so on. So, this needs attention, and not in isolation to other systems. Yeah, we should work together, all sectors in the different directions. So it needs another session to explain how it is interlinked. Yes. Okay.
Perfect. Sorry, I was taking notes because obviously, like, we want to continue this, and we hope that, of course, we're going to continue this for another 10 years. Even though I hope in 10 years we don't need it anymore, but like that's probably a bit too utopic at this point. No, but thank you so much for your insights, and I think that is really like the core of it, right? We need to find ways to connect sectors and really have sectors talk to each other, stop acting in our silos, stop acting within our fields only and in our own language, but really build these bridges.
Yeah, and people start to do the same thing in different sectors. They can complement each other, not to start from the zero. And even at the university, for example, at the university, they do many programs for prevention and for surveillance and everything, but they are not connected to their colleagues, even in other universities or to the ministry. Yeah.
So next time we will also bring someone from Cairo University, maybe.
Yes. Yeah.
But this idea of like how this can be bridged, actually, I want to go back to this, and I have a question for Dr. Nicole, because you have also lived in many different cities that have probably similar levels of pollution as Egypt. And you have worked in a think tank, so I assume you were also, exposed to very different solutions and approaches. And I'm wondering, maybe you have one of your favorite or best practice stories that you have seen that maybe you want to share with us, or kind of like say, like expand a little bit on what are approaches that you've seen working so far.
Yeah, thank you. Just also want to comment on these connections between the COVID and climate, because it's just that we need to be careful, right? And I think it was well explained that it's not the climate that created COVID, right? But it's acting as a driver of, you know, and making things, in the end, climate is an accelerator of so many of other problems. And I think the planetary health can really brings us a chance to bring more attention to also this, for example, biodiversity degradation, which is, you know, you don't see Fridays for Future for our, you know, forests and natural ecosystems that are really the basis for everything that, or even access to water, that if you see the data, you know, we can, so many places that it can be water scarce, you know, but in 10, 20 years. So it's not a, you know, for the future. So that's a very important distinction there. And yes, I did live in Bangkok, and I enjoyed very much, except when we had, you know, and I've been going there for a decade. So when you see things there, they seem to be changing. And what is not interesting, but is happening in terms of air pollution, that, you know, normally we think this is a problem in the Far East, right? Cities like in Asia, or in Delhi, and we don't see, but even cities like Frankfurt here in Germany, the levels of pollution are very, very strong. So we do have, in a conservative way, you know, 7 million people working, dying per year due to air pollution. So Bangkok, for example, had a very difficult crisis in January 2019. And I was living there, and it was just going out of the street, you have your throat burning, you know, you cannot breathe. That's a very serious crisis when you go out and you cannot have the most basic resources, that is to, you know, walk and live, which is air. And we had to close the schools. So it was at that time, of course, we didn't have COVID-19, and, you know, it was not normal to have all these kids at home not going to school. So just shows the beginning of how problematic it is to have, you know, this pollution in general for and affecting our health, and also the way we live. In terms of solutions, I don't have a favorite one, because it's really about, I just wanted to highlight that it's not about reinventing the wheel. Now, we all know that we need to have a decarbonized economies, and there are many solutions out there. But I would like to highlight something that was very interesting coming now from the World Health Organization very recently, who is also now being more open for these connections between environment and health, which I don't think that 5 years ago, we didn't see the World Health Organization being so active, at least through this terminology of planetary health. I'm sure of course, they had even a division dealing with environmental and health aspects. But it was interesting to see that maybe 10 days ago, they actually had an event talking, you know, no health without planetary health, which is something that's very new, and it shows that the people are waking up for these complexities that we are all talking about. And there was very recently this prescriptions for a healthy and green recovery. It was a manifesto that they put out there. And there are 6 guidelines that, you know, sounds, that gives us a direction. And I remember, it's like, of course, you have to protect and preserve the source of human health, which is nature. And, you know, normally the problem with nature protection, and you see something that is out there, right? Especially with the large process of urbanization, everybody lives in cities. So you don't know where your food is coming from. You don't know, we don't see perhaps these green areas. You just don't, you're so disconnected. So I think now it's time to bring these connections at the, you know, also at the mental level, because now there are also studies showing how the exposure to nature improve mental health, for example. That's something we forget to talk about. And yet mental health problems is something that we're seeing with COVID very, very strongly. So that's not a, you know, a nice to have, but it's perhaps a very important way to tackle this modern disease, which is depression and, you know, anxiety. Then there's, of course, investing in essential services. As we know, water and sanitation are essential ways to combat this pandemic. And everybody's saying 2 guidelines is stay at home and wash your hands. That's not possible in a large part of our globe, what we call now the global south. And of course, I'm sure Egypt is also going through very difficult measures if you have to do social distancing and everybody has to, you know, not every region has this access. And third, you have to ensure a quick and healthy energy transition. Of course, we've been talking about renewables. This is very much connected to air pollution, and you have to, and fossil fuels. But So to promote, the next is like promote a healthy and sustainable food system. We see this also disconnections of how much impact of our footprint is the way, you know, sometimes it's not about cutting, but of course, if you reduce consumption of meat, for example, I know there's also cultural aspects related to that, but there is something that I would maybe recommend people to check called Planetary Health Diet. This is out there, and there was also a commission at the Lancet who did, you know, and presented some of the guidelines to what would be a diet that can also help the planet. And then we have to build, of course, healthy and livable cities. So what is interesting is that architects, is not only, what I like about planetary health is not really about having, the solutions are not inside the hospital. You know, you see the solutions for this pandemic are not only inside the hospitals. And I do like the point that it was made before, that you need, I think it was Ragia talking about the education of, you know, medical and other disciplines into this. And here in Germany, we are collaborating very much with the German Climate Alliance that has a lot of, you know, it's basically moved by health professionals, and they're very much open for these discussions. And this is new, so you can start, they are actually asking for change in the curriculum. That's a way. So it's very simple. It's not only politicians. It's like you have your university dean can also change what they're teaching so they can act in the future. And finally, and that's my favorite one, is stop using taxpayers' money to fund pollution. That's a very simple one, because you have $400 billion every year for subsidies to fossil fuels. It's there, it's calculated, everybody knows. Of course, it's not an easy transition, but we need to move this money to, you know, it's about the incentives that we are giving to our economies and to our people. So, but if we include in this $400 billion, if we include all the health and damage that we are having, some, you know, also calculations, and it's estimated that $5 trillion is the actual cost of this. So imagine how much you can put into, you know, water, sanitation, livable houses, better energy, stop, you know, cooking with cook stoves that, you know, with coal. And so it's really about, yes, breaking the silos. And we know that's everywhere you go, we have this expression. I'm also very much interested in what does it mean? Because it's difficult to, you know, breaking the silos, it's easy, but to, actually it's not easy, right? It's just we cannot have 10 PhDs or 10 professions that you have, but it's through partnerships and collaboration. And at least finally, it's very interesting because at the personal level, people also need to be more adaptable and resilient. So perhaps the solutions is not really about prediction of pandemics or calculations of things. It's like, can we also invest in adaptation and resilience of our own people, which is really through that social movement we were talking about. It's about social empowerment, so people can also drive their own solutions, and they're informed and they can take action on themselves. Thank you.
Thank you so much. And I want to give Ms. Ragia and Dr. Wagida the chance to also comment or contribute to that if you want, before we move on to questions from the audience.
Okay, Dr. Wagida first.
You're on mute.
Okay. So.
Okay. Okay. You know, all these interrelated subjects and the new concept of planetary health need to be more emphasized and more orientation, as I mentioned, in different levels, and maybe in the educational part, in the schools and in the university and in civil society. More education and more health education to people, because health education will lead to prevention, and maybe we try to avoid either environmental risk or health risk. People know where to go when they are sick, and where to take the services and all. Guidelines is very important, either to the doctors and healthcare workers and you know, leaders in the health system or environment system, you know, guidelines, but simple guidelines to be practiced and to be distributed. Most of our problems are related to miscommunication between people, and sometimes teachers give lectures, and but it's not practical, not easy to understand. So I hope more actions to be taken in different sectors concerning environment, health, and I hope COVID will disappear soon, inshallah.
Thank you so much.
Yes. Thank you, Dr. Wagida and Nicole. Of course, yeah, we are not going to invent the wheel. The problem is that the wheel is not moving. So it is known that we should move to a low carbon economy, stop being highly consumption, and a lot of waste is produced, heavy energy usage. But well, I think the people with the power, which are the international, for example, companies and powerful government, they are looking for the short gains, the profit. And the people who are interested in the long term, the majority of the population, they don't have the power. So this is the problem. I don't have solutions, except like Nicole said, also it is a social movement. And maybe something like the COVID, which is clear that destroying the environment, destroying the wildlife, humans have wiped 80% of mammals of the earth. We have, there is a million species on the brink of extinction in the coming decade. No other species on the 3 billion years, which is the age of the earth, has done what we have did. So we are now risking our own existence. And yet there is the reaction is not good enough. I think there is a good chance in the recovery, from the economic recovery now. While the government is giving what's the stimulus package or the subsidy package, that it should be given to, for example, to public transportation instead of car industry. In Egypt, there has been some, the government did some good things and missed a lot of chances. For example, I've heard of more than maybe 15 billion pounds giving to car industry. Of course, they have a lot of laborers, but maybe if this was given to improving public transportation, or for example, shifting to electric vehicles, and in Egypt, maybe not electric cars, but why don't we think of small vehicles, electric scooters, for example? This is a very good solution, and a lot of women would be interested in using scooters because it saves them the transportation. Egypt, we have done some restoration of the biodiversity in the northern lakes. This is very good. Yet other things like, for example, the new cities, they are not built to be environment friendly. There's a lot of highways built. This is contrary to making space for biking, for people to walk, for mobilities. So designing the urban in the new cities, encouraging public transportation, as we said, building on the behavioral changes which happen. There is a good chance using this recovery package in stimulating the low carbon activities. I hope it will be done. Thank you.
Thank you so much. Yes, this was a great brainstorming of sorts of like everything what's wrong and everything what needs to be righted in a way. I want to move to one question that really stuck with me from the registration, which is like in the registration process, we ask the audience to ask questions, right? And then we kind of try to include them into the questions that we're asking. And somebody asked, how can youth be involved in mitigating the crisis? And I felt like, I felt very happy when I read this message, because that obviously comes from someone who wants to
do something, yeah.
Exactly.
Yes, yes.
Which is obviously something that we want to encourage. So maybe all of you or one of you can give a small advice, keeping in mind that we are kind of almost running out of time.
Well, I will just say briefly, and I've mentioned it before, that youth have been involved strongly in the COVID, before the COVID, in the environment in general, and maybe it's good now to cross the boundaries. Youth groups working on environmental issues and waste alone can connect with those who were working on health and promoting and giving food for the needy during this crisis, and exchange information, deepen. It's not just one misfortune, the COVID. No, it was caused deliberately almost. So I think, and youth are good, very good in finding each other, in connection, inventing new ways of action. So that's it.
I believe that the peer education or the advice when it comes from a friend will be more effective than coming from an older person. And also if the role model comes from same age, this can be more effective. So I hope this can be encouraged among the youth program.
I contribute as well? This is a very important question, and I'd like to say maybe three things. The youth, it's one of the reasons that the topic it's expanding and putting pressure on politicians. So that's part of the movement. There are many ways they are, the youth major group under the international organizations that they can register. They can be part through local organizations. So first, it's find local organizations that could put you in this pool of advocacy groups. The second is the same advocacy groups, it's important to enter, not only be part of, making protests, and this is very important because it's put pressure, we need both, but my advice is also try to get your network developed, right? You need to enter different fields. If we're talking about breaking the silos, we need to talk with people from the health, from the financial aspects, from the embassies, the political level, the education. So try to get knowledge from different networks, and of course also the inequalities. Once you're youth from different parts of the world and not only from the usual suspects, which is North developed white kids, it's very important that we have these different voices. And I leave an invitation. We are the Women Leaders for Planetary Health. We do try to be, global. We are for the moment based in Germany, but we do have even connect to people in Cairo, Brazil, where I am from, in Latin America, in the Pacific, in Southeast Asia, and Africa. So it's very important that we have the most important is that youth can bring also the diversity of voices. So that's very encouraging.
Perfect. Thank you so much. We are actually, yes, almost out of time, but I do have two questions from the audience that I want to ask you still. The first one is, what do we need to enhance the capacities of workers in the health sector to deal with climate change impacts? And are there currently running projects in this regard? not directed to anyone in particular, but if anyone feels like they have something to say.
So the healthcare workers, you know, need, as I said, to be prepared for any new wave of infections by more capacity building, more training, more, as I mentioned, the guidelines, easy guidelines to be taken. And this will be helped by the availability of treatment and specific treatment and vaccines.
Okay, so then I will move on to the next question, which is, how do you think education will look post-COVID, and how can we include the environment in that education?
I just want to comment on that one, because I think it's, of course, very important. And we see, especially now linking to the youth again and the young kids, they're out of school, right? So they're really losing a very important time that they could, you know, get this education in this crucial moment of their lives. But we're probably going to see more the importance of digitalization, and that's the connection with, you know, digital tools and sustainability, which is a little bit of a new agenda that is developing a little bit more seriously. I know that the German government here also, they had the first report about digital tools and sustainability, and I think there, you know, I haven't seen too many countries doing that. So I think that's the revolution we're going to see, and again, there will be another probably potential gap, because to have these tools you need the technology. So we're going to learn a lot how to have perhaps also not necessarily one subject, but you can, if you need to be interdisciplinary, you can also combine and be a little bit more free to how you got your education, considering also soft skills, because it's not only, as we're saying, it's not about the technical part, it's about speaking, it's about now entering new networks, it's about presenting yourself, it's about networking. So I'm interested to see how this will evolve.
Yeah, I would like to add that, you know, COVID was, you know, give us an advantage of using this learning. And so it has advantage and disadvantage. So we should use the part which is useful and combine it with the traditional way. It's called blended program, so that we can take the advantage of every, and include whatever knowledge we need regarding the environment and the climate change and so on.
Well, for me, I am worried, of course, about the inequality because rich people they have laptops and everything, and the poorer or the less educated with the rural areas, they don't have these ITs. But this is not going to last forever. The coronavirus, the COVID, is going to accompany us like the flu did, the influenza. So it will not be that severe, mostly maximum the next year. Then it will be just a regular disease of humans. But about including it's a good chance also to include the environment in the curriculum. I think there has been some in Egypt here trials from the civil society experiments, but it's not yet formal. I mean, the Ministry of Education is not implementing environment in the curriculum, and maybe this is a field which we should try. Thank you.
Thank you so much. And there is one last question that I would like to ask, because I think it might also be a good way to kind of sum up everything that we talked about and kind of bring it back to the initial question: are we actually asking the right questions? The question reads, I still don't understand a direct causal connection between climate change and global warming and the outbreak of corona. There were other outbreaks of other diseases in other centuries.
I think I mentioned the relation of the climate change, this deforestation, and the animal movement so that they can cause from animal to human transmission, which is increasing with the climate changes. Yeah.
As I also mentioned, this is, I don't think it's not climate change causing the pandemic, but it's making these drivers of other problems connected, especially with biodiversity loss. That's where the animals and wildlife live. So they could, that's how you increase the possibility and risk of zoonotic diseases. So climate change, biodiversity degradation, they are connected as well. So this is making things worse.
Ragia, do you want to also comment, or you feel that everything is said?
Well, I think I can say it in different words maybe, but it is the same like my colleagues said. Mainly the emerging disease coming from animals, they come from our pressure on the wildlife. When we remove the trees, when we remove the forest, by the way, it's estimated that a size like England, the size of England is lost from the tropical forest every year. So this puts a pressure on the bioequilibrium in the wildlife, including the pathogens. We stress them, they lose their habitat, they become looking for another host. And the close interaction between humans and the wildlife, because what happens when we remove the forest is that we go undergrow the land, we build streets, we houses, we even dig mines. So humans, we eat bush meats. So humans are there. So the pathogens looking for a new host because they are his old host from the loss of habitat, the loss of biodiversity, they jump the barrier. Like they say, they spill over because usually pathogens are limited to their hosts, but if they are pushed, they can jump, especially the viruses, and especially the RNA viruses, because they are highly capable of mutations and of making these jumps, horrible jumps for us. Thank you.
Thank you so much. This has been such a great conversation with so many different points that that came together and kind of created this. Like, I think I really understand now, Dr. Nicole, what you were saying in the beginning, that planetary health is also a narrative, because it has all of these stories in it, right? And all of these stories matter, and all of these stories need to be told and need to, be co-created, really. From my side, I would say that my main takeaway so far was really that this is a moment like maybe the right question is not to ask, is this good for the environment, but rather, can we learn from this shock? Can we use this moment of shock to realize how much we really need to invest in transdisciplinary approaches like planetary health, and how much we really need to invest in building resilient communities and creating awareness going forwards, not only within the environmental community, not only within the health community, but really in all communities. And I think this conversation has really, really highlighted the importance of that. And I'm also really happy that something else was really highlighted in the conversation is the need to talk about solid waste and what COVID-19 means for solid waste. And this is going to be a cliffhanger, because this is our next CCT's topic. So I'm very glad that this was already introduced, so we can actually build on that in the next time. Thank you so much for being absolutely wonderful panelists and for really enriching us all with your knowledge. Thank you so much, and I hope you have a beautiful evening.
Thank you very much.
Thank you very much. Enjoyable.
Nice. Yeah.
Thank you.
Thank you.
Hope to
for
see
our participation.